It's a truly honor to be here. I would like to begin sincerely thanking to the organizers and the committee for the opportunity to present our work. And I am also deeply grateful to my co-workers, my college, and the Human Milk Bank team, whose dedication and commitment made this research possible. So today, I will present you the calorie content of breast milk response to a weekly nutritional strategy for breastfeeding mothers. This. The introduction is the nutrition of lactating women is crucial for the health of both mother and infant. Lactating women should meet increased nutritional requirements since during lactation, the needs for almost all nutrients increase due to breast milk production. Regarding caloric intake, an excess of 500 calories per day is recommended to meet the demands of milk production. However, many women do not achieve this level of energy intake. The most common deficiencies among lactating women are deficiencies of vitamin A, folate, vitamin D, selenium, and iodine through diet alone. Adherence to a health diet such as the food pyramid is considered a recommendation during breastfeeding. Material and methods. We made a prospective, observational, analytical, longitudinal study. Was conducted at the Human Milk Bank of Dr. José María Rodríguez General Hospital in the state of Mexico. The crematocrit was determined in 20 samples from donor mothers who were offered nutritional counseling every week for 3 consecutive weeks and then 1 month after the last consultation. A total of 7 weeks, crematocrit was measured weekly. Nutritional counseling was individualized by the milk bank's own nutrition staff. Only these cases were documented. The nutritional counseling was based on an 2,500 kilocalories per day diet in accordance with the international recommendations for the nutrition of lactating women, providing 50% carbohydrates, 26-27% proteins, and 23-24% of fat. For the results, we made a statistical analysis, including minimum, maximum, mean, and the standard deviation. 20 patients were selected. They range in age for 27.2 years, with the standard deviation of 24 to 30 years. The minimum age, 18 years, and the maximum age, 44. The gestation period was 34.7, with a minimum of 32 weeks and maximum 36.5 weeks. So the initial crematocrit, day 14 of lactation, was 576.5 kilocalories. The second crematocrit, 7 days after the first nutritional counseling session, was 663 kilocalories. The day 21 of lactation, and the third crematocrit was 744 kilocalories. Sorry, this is a typo. After 28 days of lactation. And the last one, crematocrit, is the number 4, was 827 kilocalories after 56 days of lactation with 3 nutritional counseling sessions. So in this figure, you see the increase, the crematocrit every week. And in this figure, I show you the technique of crematocrit. To calculate the crematocrit, we use capillars, a centrifuge, a ruler, and a calculator. The formula was from the neonatologist, Dr. Lucas, dating back to 1978, the publication. So first you fill the capillary tube with human milk. You centrifuge with approximately 15 minutes and 150 revolutions per minute. Then you place the capillary tube in a surface and measure the distance from the, then you measure the milliliters of the cream. For this example, the millimeters of the cream are 3. So this is the formula, and in this case, 3 millimeters, you multiply for 100 is a constant. After that, you divide it by the height. In this case, the height is this is 5.6 millimeters. So the result is 5.35% of cream. After that, the percent of fat is the percent of cream. So you divided 5.35 with the constant 1.46, and the result is 3.26% of fat. Finally, for the calories, is the percent of cream multiplied the constant 66.8 and plus 290. So the final result is 64. So discussions, the results of this study confirm that the energy composition of human milk is not static, but rather responds dynamically to changes in maternal nutrition. Traditionally, it was believed that the breast milk quality remained a constant even under moderate nutritional deficiencies. However, our findings consistent with the previous evidence that Lucas, Lonergan, Victoria, and we demonstrate that the calorie density of milk can be significantly modified through target nutritional interventions. The average 43.5% increase in energy content after weekly nutritional counseling highlights the critical role of the dietary education during lactation. This improvement translates into better calorie support for infants, especially during the early months of life, when rapid growth depends almost exclusively of breast milk. Furthermore, the independence crematocrit values from gestational age suggest that both preterm and term lactation mother can enhance the quality of their milk through balanced diet. This funding supports the implementation of continuous nutritional guidance, particularly in milk banks and breastfeeding support programs serving food insecure population. The conclusions: it is crucial to provide nutritional education to breastfeeding mothers. It is important that the breastfeeding women receive appropriate nutritional counseling to ensure a variety of balanced diet and to meet their increased nutritional needs during the lactation period. The crematocrit value is independent of the donor mother's gestational age. As a mother of premature babies had a low crematocrit, we have 400 kilocalories per litro, and mothers of full-term babies had a high crematocrit, 700 kilocalories per litro at 14 days of breastfeeding. After the nutritional counseling, the crematocrit increased by average of 43.5%, demonstrating that the crematocrit of a lactation woman is influenced by her nutrition, regardless of whether she's breastfeeding mature milk. So this is the reference. Thank you so much.